The House of Representatives Committee on Healthcare Services has lauded the inclusion of the National Health Insurance Scheme (NHIS) in constituency projects. The chairman of the committee, Tanko Sununu, announced this when the executive secretary of NHIS, Mohammed Sambo, appeared before the committee for the 2021 budget appraisal. Sununu said the developments will ensure that people at the grassroots benefit from the scheme regardless of their status. Sununu urged lawmakers to embrace the humanitarian service in the interest of their constituents.
Important is we must understand what is the principle of health insurance scheme. It is a pool of money they are generating so that everyone will be his brother's keepers. He has just mentioned that philanthropists, well-to-do individuals can contribute money to that pool. And one good thing that why we endorse it is that you have the right to describe the particular groups of individuals you want. And for those of us that we've just started last year, those of us that engage, especially if you go to my constituency, and I engage myself, I target it to those who are 60 and above. Because they represent, I don't say that others don't need it, but they are a special group that deserve to be catered for. If you go to other countries, you see a lot of hospices, aged home, but that's not the practice in the country. Then we should have a group of people that can now take care of them. You can also say you want to go for only the blind people. You can only say you want to also go for only farmers. So you have the right to choose which group you are going to. And also why we endorse it again is that you are free to go to NHIS to ask why your people are dissatisfied with their services.
Earlier, the executive secretary of NHIS said they have developed a platform called Group Individual and Family Social Insurance. Sambo explained that it is a platform that will bring individuals, families, as well as groups to pay a premium on behalf of people in their communities.
Which is only targeting the people that are employed in a formal setting, either public or private. But other self-employed groups or individuals had no opportunity to join health insurance in the past. But this new initiative, GiveShip, that has been introduced, is a platform that can bring individuals, it can bring family, it can bring people from various groups, it can bring people even from diaspora, it can facilitate philanthropists to come and pay premium on behalf of the people in their communities. And this program is also, the constituency project for health insurance is also tagged along this GiveShip, where members of the National Assembly can put some funds in the National Health Insurance Scheme with a view to covering the people in their own communities. So this is a platform, we will call it a master stroke, that will bring about a total coverage of Nigerian population.
During the budget defense proper, the House asked the NHIS boss to provide the sum of 3 million naira that was not utilized in the 144 million naira budgetary allocation for agency in 2020. The NHIS boss, however, pleaded with the committee to give the scheme till next time to provide details of how it was utilized.